African-American female that Fauci commended and made him hopeful, because I think she helped put the vaccine together and patent it. And so I think that's will come up in our discussions too. Let us pray. I want to thank all of the participants, and I want to thank those who worked to put this together so that we could be better informed about the vaccine. Let us pray. Lord, for this day we are thankful. We always acknowledge that you are the Lord of life and the giver of every good and perfect gift. And we live up to the best that is in us to model what it is we have learned from our Savior, Jesus, in order to be the light of the world and to provide what it is people need in order to be inspired to fulfill the purpose for which they exist. We're thankful for those who are participating tonight, those who are sharing their expertise. We're thankful for those who put it together. We pray that what we receive here this evening will somehow inform us, but not only inform us, inspire us, so that we're involved in doing what we need to do in order to make sure that we handle the pandemic as well as possible. In the name of Jesus, we pray this prayer, and for his sake we pray it. Amen.
Amen.
Okay, Pastor, thank you. Folks, my only responsibility tonight is to go over the ground rules. Hopefully everybody has those. They were part of the Zoom invitation. And there are only 4 things to remember. The first thing is we're asking you to mute your phones or your computers if you are not a participant. And the participants only include right now, Valerie McDonald, who will be our moderator, Dr. Mantu Davis, Dr. Franklin Pratt, and Melanie Burr. And I will be muting myself as soon as I turn this over to Valerie. Helen Starks has agreed to be our mute lady for tonight. So Helen, I want to thank you. Also, I'd be remiss if I didn't acknowledge Dr. Stephanie Quarles and Dr. Lauren Walton, members of our church. They are going to man the chat room tonight. We're asking you to put your questions in the chat room, and they will be coordinating our question and answer session. So having said that, we're going to follow the agenda as it's printed, and I want to acknowledge Valerie McDonald. Valerie did all of the legwork with Dr. Davis's office to put this Zoom meeting together. So Valerie, thank you for your leadership with Christian Women on the Move. And also thank you for all the work you did to put this Zoom meeting together. And Valerie will turn it over to you, and she will introduce the UCLA educated Dr. Mantu Davis and the rest of the team. So Valerie, thank you.
Thank you, Bill. I'd like to also thank Regina and Helen for coming on earlier to help us straighten out any bugs we may have seen before this presentation gets started. I'd like to just go right ahead, introduce our panel, which is Dr. Mantu Taylor. I'm sorry, Montane Taylor is a member of our church. Dr. Mantu Davis, who is the Public Health Officer for Los Angeles County. And he has assembled a team here that is really remarkable. Dr. Frank Pratt, who is the medical director for the Vaccine Preventable Disease Control Program. And we look forward to hearing and seeing his presentation. And he also has Melanie Burr, who is an RN and director of the Nursing Immunization Program. So we look forward to hearing from all of you this evening. And with that, I'm going to pass this over to Dr. Davis.
Thank you, and it's nice seeing you. I haven't seen you in a long time, Valerie.
Nice to see you too.
So I appreciate being back. The last time we talked about COVID-19 and answered general questions related to that. This time we come back to talk about COVID-19 and vaccines. And I want to say that, in general, we've seen people go through a spectrum of whether or not they want to get the vaccine or not. I can say that I personally have gone through that spectrum. I ultimately did get vaccinated. I've received my 2 doses. And during that time, there were a lot of things that were on my mind in terms of considering whether to get it or not. And ultimately, our goal here today is to really provide you with information that may be helpful wherever you are in your decision making around whether or not you want to get the vaccine if you're offered it or not. But we want to make sure you have good information and you make an informed choice. The 2 colleagues I have with me are really great. They're going to help present this. And Frank and Melanie, I don't know if you want me to share the presentation and I move through the slides, if that makes it easier for you guys. Just do a thumbs up and I'll do that. But we will share the presentation and you'll hear from all 3 of us. And then we hopefully will leave a lot of time for you all to ask questions, so that we can get the information that you need to know. Okay. So I'll go ahead and share if I can. Actually, Valerie, I think you or someone.
Well, yeah, I was about to say, I think Dr. Pratt came on earlier so that we could, so that he could do the presentation and share the slides with us.
Okay.
Yeah, I'll go ahead and share.
That'll work.
Beautiful.
So Frank, we'll need you to share the slides.
How are we looking?
Good.
It's coming up. There it goes. Okay. So just a couple of sort of heads up. As I mentioned, our goal here today is just to provide some information around COVID-19 and the vaccine, as well as some updates on where things are with vaccinations, but to give you guys time to ask questions. In general, as you will see tomorrow, and I would encourage everyone to, if you have a chance, to look for updates. Dr. Paul Simon will be talking more of an update around vaccinations and who they've gone to in our county. And we'll be sharing some information on the distribution of how people who have gotten it so far and where they live. And you'll see some disparities in that data. And we'll talk a little bit about that tonight, but more vaccine distribution so far. You can go to the next slide, Frank.
It's not scrolling down. Oh, okay. I just found, I'll have to use another. Okay.
All right. So in general, the way things are going in terms of our county, we think they're going pretty well. There are some things that we have to change in the system, but it's the system we've been dealt with so far. So we'll share some information, up to February 16th, from what we know. And we'll be talking about the 2 vaccines that have been authorized for use in the United States, and that's both the Pfizer and Mrna vaccines. And then you can see our website for more information. I will say that the vaccinatelacounty.com is the place to go to look for locations where vaccines might be available, and the location to set up, try to schedule an appointment for yourselves. Can you go ahead, Frank? So as we go through this, one of the things that we want to keep in mind is that the effects of racism, just in general, with all the health disparities, with the way that communities look, what's in them, et cetera, those effects, must be recognized as we have seen over the years in relationship to health outcomes. And at the same time, some of those thoughts and ideas come into play as we looked at COVID-19 disparities. And as we look at vaccination and where vaccinations are needed. We want to make sure that, again, we acknowledge and respect everyone's concern, each and every one of you, and understand that we have seen a history of some mistreatment, which has led to distrust in the community, in various communities, not just Black communities, related to medicine and the medical field. As we go through this, we know that it's not just what we do, what we talk about as a public health department, but it also is feedback, input, and action by each and every one of you in your own communities and as organizations, around this and other efforts. That's important. No matter what we do, it's always a partnership and a collaboration, and it takes each and every one of us to play some part, whether it seems small or it seems large. All of it is necessary to get what's needed to improve health and well-being and to maintain good health and well-being in all of our communities. Again, what we want to make sure that we do today is to give correct information, and many of you are more trusted than we are as health department staff, and you talk to folks, and if it's what you understand and you share it with them, sometimes it's better received than if it's coming from me, Dr. Pratt, or Melanie. So we do acknowledge that many of you are trusted messengers in your own communities. Go ahead, Frank. As we go through this, we will talk about the vaccines, talk about how they work, how they developed, safety questions and information, as well as how they're being distributed, and then how to get vaccines, but more importantly, to really go through myths and scams and where to get more information if you have questions. Go to the next slide. Now, this is probably the worst of outcomes as we look at what happens with any disease, and that is death. This shows older population, a high proportion of older populations. We try to adjust that for areas with younger populations in order to get a stable rate related to death or illness. So that's what age adjusted means. And as we look here, you can see that areas that are more heavily concentrated with poverty or folks living at poverty or below poverty have seen higher rates of death. In addition to our Black and Brown communities have also seen higher rates of death in comparison to the county in general, as well as other communities. And so as we look at this, this is something to keep in mind. It's not something to necessarily fear, but it does show you that there are disproportionate adverse outcomes or serious outcomes, death being one of those in these areas and with these communities. In the next slide, please. Sometimes, looking at information in a table is good. For others, sometimes it's visually seeing it. And so here we map out by city and community, and we show, both the death counts, which is what you see on the left, and then the areas with the darker color are the higher death counts. And then when we look at rates, that's based on a population, so per 100,000 people. What's the rate of death experienced? And that's what you see on the right. And as you can see, sort of in that central southern portion, we start to see darker color, which is higher rates of death in those particular communities in those cities. Again, this sort of helps to show that sometimes the numbers don't tell the full story. So the equalizer is the rate. So you can see how it compares based on the population in that area. You go to the next slide. And much of this information is actually available on our website. And much of this we've gone over before, but just in case for those who weren't here last time, COVID-19 is caused by a virus. So it's not like strep throat where you take an antibiotic and it just goes away. This is a virus, and so it has a different course of illness. And viruses can, again, infect people in different ways. So some people will not get symptoms, although they are infected and can transmit the virus to others. Some will get mild to moderate symptoms, and others will get very severe illness and end up in the hospital. And this is more likely in our older adults and then with people with underlying medical conditions. And I will say, though, as we've looked at this, in general, we've seen about 94% of people who have died had underlying health conditions. But I do caution you and understand that 7% of the people were healthy and did not. So it does impact all groups, no matter whether or not you have an underlying health condition or not. But those who are older and have underlying health conditions are more likely to have a severe illness if they are infected with COVID-19. The symptoms do vary. We've seen people, again, have no symptoms, and others have just a loss of taste or smell, and others have your typical influenza-like illness, but it does vary amongst different people, different populations. There's no consistent pattern in terms of everybody gets this or that. And again, we know that people can pass the virus to others even if they don't have symptoms. Some of you may have seen or noted that even if you didn't have symptoms and you tested positive, when we go back to look to see who was a close contact, we go 2 days before that test was drawn, because even 2 days before symptoms show up, people can transmit the virus to others. So you can't always tell that someone who has COVID-19 is infected because they may not look like it and they may actually feel well, which is why it's important to use face coverings whenever you're around somebody you don't live with, why it's important to keep your distance, and why it's important to wash your hands, especially when you're out and about, and once you return back home, and why it's also important that if you tested positive or if you are ill, whether it's COVID-19 or not, you stay away from others, okay? All right, we can go to the next slide. And I'm going to turn it over to Dr. Pratt to go through the vaccines, okay? Thank you.
Thanks, Dr. Davis. With that introduction, vaccination saves lives. We know that it's safe, effective, and worldwide, you look at all the vaccines that are administered, millions of lives are saved each year from many kinds of diseases. And one of the benefits of vaccination, just in addition to us, is we vaccinate our families, we protect our families, we protect our coworkers, and we protect our communities. So what appears to be just a benefit to an individual, in fact, is magnified and multiplied. And when we get down to the final decision, if you will, as myself and Dr. Davis and I discussed, I was a bit hesitant too. We just balance what are the benefits of vaccination versus the risks. And we see where that balance lies for us as an individual. In summary, vaccines fool your body. Vaccines represent some component of the virus, in this case, that fools your body into thinking it's a dangerous intruder, and the body just mounts its usual immune response. Of course, in this case, it's not a dangerous intruder, but it fools the body. It mimics something that the body knows shouldn't be there. And that's what develops the immune response. And that's how most all vaccines work, is this process of mimicry, of fooling the body into creating the immune response that when you are exposed to the real pathogen, the real germ, the real virus, the memory in your immune system kicks in and defeats the virus in this case. The two vaccines that we're really focusing on are what are called mRNA vaccines. And in the most straightforward way, mRNA is just a little snippet of genetic material that's put into your body. It's inactive in any other way. It's not connected to the rest of the virus. So it can't infect you or cause you harm from that point of view. It just is a little bit of information that your body, again, recognizes as an intruder and causes antibodies and other cells to be activated to give you immunity. And that way, the next time you're exposed to the real virus, the body says, oh, you're back. I didn't like you before, and I'm going to defend my body against you this time. That's how the vaccines work. They don't get into our DNA. They have no impact on the rest of our cellular function. They're just this little snippet of material that acts as a stimulus for your body's normal response.
If I can add really quickly, Frank. So I want to highlight that point around mRNA. mRNA is used by the body to make proteins. And so what Dr. Pratt is talking about, the vaccine gives that code to make a protein that is similar to a protein that's on the vaccine. So the body recognizes that. It's not the virus itself, but that's what that snippet of material is. It's just the code to make a protein. And so, as he mentioned, it does not go into your DNA. It is just a template for making the protein that the body uses to mount its response.
Thanks. And the two we're talking about are virtually the same vaccine. They're the same technology, the same product. One is separated by 21 days between doses, and the other is separated by 28 days. But we do want you to take the same brand of vaccine for each of the two doses, but their function is very, very, very similar. And we'll see that when we talk about some of the impact they have on your body in terms of side effects and how effective they are, because these are both in the 94 to 95% effectiveness range. They're incredibly effective because, as Dr. Davis said, that mRNA represents the essential protein that's needed for the vaccine to get into our cells and cause us harm. The side effect profiles are very similar, and they're very real. I know I had them, but they were short-lived. They came on quickly within a day or two, and they were gone within a day. Things we're used to in many facets of our life: a fever, muscle aches, a headache, just fatigue. And these are all good markers for an immune response that's going to be a benefit to us. The caveat, the warning is, please don't delay or not get the second dose because you're worried about the side effects. Again, they come on in a day or two and they're gone in a day or two. And they're, again, very much less dangerous or unpleasant than having a COVID infection. Sometimes if you have COVID when you get your vaccine, you won't know it. As Dr. Davis said, you can be asymptomatic for a couple of days while you're still infectious. So it is possible that you can be given the vaccine after the first and the second dose and still get COVID. It's extremely uncommon, but it's something to be aware of. So if your symptoms last for more than that day or two, that's when we want you to get in touch with your doctor or your other clinician and explain what's going on, because there is that chance that you do have COVID. It takes time to get that immune response ramped up, usually a week or two. So there can be that crossover time when you're susceptible to getting the infection. You've heard about, well, let's just have people get herd immunity and we don't have to worry about the vaccine. We don't know how long the natural immunity lasts. We don't know how long the vaccine immunity lasts, but we know that you can get the vaccine and have protection, we think, for a very long time without getting really sick. That's the huge benefit of the vaccine. And we want you to get that protection right away and have natural immunity not part of the equation. We want that vaccine to work right now within that week or two to protect you. So that's why we're putting out that the COVID-19 vaccination is a safer way to build protection, and most of the time a quicker way to build protection versus natural immunity. As Dr. Davis said earlier, we've been working with mRNA actually for 15 to 20 years. We've also been working with coronaviruses for 20 to 30 years. And people ask, how did these vaccines get, available for use so quickly? Well, in fact, we had a head start because those two bits of knowledge were being accumulated for years and in some cases, decades. We had existing relationships with research networks so we could quickly administer the candidate vaccines to people and start the testing process. And we kind of had an insurance policy from our federal government. The vaccine manufacturers usually make sure the vaccine is successful before they commit literally millions of dollars into the manufacturing process. This time, we, the people of the country, committed to that insurance policy on the manufacturing process. So we have two parallel paths, a manufacturing path and a physician clinical science path occurring simultaneously when usually they would be done sequentially, and that's what helped get a vaccine out in under a year. The key concept here is that the safety standards were the same as with all other vaccines. We tested the vaccines in 74,000 volunteers to be precise. The people who were part of the pool of people who were gracious enough to volunteer to be part of the testing process represented the American population in terms of ethnicity, race, with good representations in an older patient population. The patient population that was excluded for the most part were children and adolescents. But even that is now being remedied with children and adolescents being brought in to testing trials to see if the vaccines are equally safe and equally effective in our children and our teenagers. Both the Food and Drug Administration and the CDC applied the same standards, the same review process, the same publicly streamed question and answer process to verify that both of the vaccines were good to go for an emergency use authorization. You'll hear that phrase, EUA. The key is there weren't any shortcuts. No shortcuts. The full process. And I personally have a friend who's on one of the panels, the FDA panel, and I assure you, she is one of the most fastidious, diligent physicians I know. We talked about her work after the fact, and she held the manufacturers and the process to the highest standard possible. And that did help me from a confidence point of view. We continue to monitor the vaccines after they're even approved. We have systems of monitoring that have been in place for decades, but this time we're adding, given that social media and technology and apps have kind of come on to things in a big way recently, we now have an app that anyone who gets the vaccine can voluntarily download to their smartphone, and they can tell us how they're doing real time, in addition to the existing safety systems that the CDC and the FDA have in place. All vaccines are continuously monitored, even ones that we've been working with for years and years and years. And we apply that same process to the new vaccines. They're continuously monitored, and if something pops up that looks like a concern, there's an immediate process to stop using the vaccine and take a look and see what the reality is. And it's done quickly, and we want to sort things out before we continue to administer something where there might be a concern or what's called a safety signal. And that's ongoing now for both of the COVID vaccines. Allocation of vaccines is basically another way of saying, when will I get my vaccine? And Dr. Davis is leading the team that puts this together in conjunction with our colleagues from the state and from the CDC. The big basic concerns relate to equity, that everyone has an equal opportunity to be immunized based upon their risk of getting COVID, the effects upon them if they do get COVID, and what they might do in terms of occupation or providing necessary functions that keep our society and our communities alive and keep our life going. And that is a constant dialogue. It's a constantly changing dynamic, depending on how the pandemic changes, depending on how illness changes in the community, and depending on the number and type of vaccines. Because as more vaccines are approved, this entire calculus, if you will, this complex equation will be visited, revisited, and revisited again. But right now, as you all know, vaccines are scarce. We don't have the numbers we want, but we look forward to getting them. According to Dr. Fauci yesterday on a webinar he was on, hopefully this summer, there'll be an abundance of vaccines, and many of the allocation discussions will be less intense than they are now. We want you to know about vaccinatedlacounty.com. Please use that as your go-to source for anything related to vaccines, vaccine availability, and distribution of the immunizations. We recommend that as the one-stop shop, if you will, for Los Angeles County residents. Vaccinatedlacounty.com. Questions come up frequently related to the vaccine, and this will highlight some of those. If you've had COVID-19, yes, we want you to receive the vaccines after you're well. It's safe to get the vaccine. If anything, it will only boost your immunity. If you're exposed and you're in an isolation period or a quarantine period, we recommend you just wait till those end. If you're given the antibody to treat you while you have COVID-19, we recommend you wait 90 days. But the summary statement is we do want you to receive a vaccine even if you've had COVID-19. It only strengthens your immune response. During the studies, pregnant women weren't included, so we don't know the long-term effects on pregnancy, but we do know that the American College of Obstetrics and Gynecology has recommended that women be vaccinated. And if there's a question about it, we advise all women who are pregnant or planning to be pregnant or are breastfeeding just to talk with their doctor about it. But the overwhelming evidence now is that the safety is there. Questions come up frequently about people with weak immune systems that could scare them. They don't want to take something that they think will harm them because they might not have the immune response that most other folks have. We want to reassure those folks. Having an immune system that's weak makes you more susceptible to COVID-19, and it will harm you more than someone who has a strong immune system. So we absolutely want you to be immunized. The only thing that might be a factor is that if your immune system is a little weak, you might not mount as strong an immune response as someone else, but you still have protection. And all of this is being studied as part of that ongoing process we talked about earlier of making sure the vaccines are effective and safe. A lot of talk about the allergic response. The highlight is that people who are truly allergic to the 2 mRNA vaccines are extremely rare. They have a known history of allergies that are severe to either medicines, vaccines, or polyethylene glycol, which is considered the culprit chemical right now, if you will. So those folks we can routinely and easily identify and take extra precautions to either not give them the vaccine, or if we do, to keep them in a safe space where they can be treated right away if there is an untoward complication. But these are truly, truly rare events, and we don't want you to be afraid of being immunized if you have a history of food allergy, allergy to pets, environmental allergies, hay fever. Those don't count, fortunately. This is a new disease. These are new vaccines. Some of the details are still being sorted out, but we're closely monitoring all the people who are receiving the vaccines and closely monitoring all the reports of side effects or unexpected clinical conditions, or in some cases, complications. As previously discussed, we have 4 systems in place to look at what's happening with the vaccines. Right now, they're not approved for children, and that work is in process. And we hope soon there'll be a vaccine that works for children, but we're monitoring everything else in the meantime. You've no doubt heard things in the news recently about mutations and variant viruses. They're popping up all over the world. It's the natural history of how a virus stays smart and survives. And this is a new virus that has jumped from the animal community into the human community. So we anticipate lots of variants. What is being shown so far is that the existing vaccines are effective. They're more effective for certain variants than others, but they provide protection. And the other, I think, corollary to that is right now, the vaccine manufacturers are creating new versions of the existing vaccines to address the variants and provide better immunity against the variants. It's like every year we update the flu vaccine because we know that that flu vaccine is changing. This process is very similar. And there'll come a time when there is kind of an equilibrium between the virus and the vaccines and the immunity. All of us have expressed our personal concerns about immunization in the midst of a pandemic with what is clearly considered a new vaccine. We don't have experience with it. Our friends can't tell us about it. Our coworkers don't know. Our family doesn't know because no one's received it yet. And as Dr. Davis shared, he had his hesitations, and he and I had a talk about his, concerns earlier today. And I shared that I had my own concerns, my own, if you will, just need for due diligence and reassurance. And we understand that, and we share that. And part of our mission tonight is to address people's questions, concerns, fears, provide good information, and connect you with trusted messengers that will help you make decisions about how, when, or maybe not, whether you'll be immunized. I'm going to turn the speaker over to my colleague, Melanie Burr, to take us through the end here. Melanie?
Thank you, Dr. Pratt. Thank you, and good evening, everybody. So just to continue on, as Dr. Pratt said, many people had some misgivings about this vaccine, and hence there's a lot of myths about COVID vaccines. One, that it was developed too fast, and I believe Dr. Pratt went over there, that it will kill more people, it can give you COVID, it affects your genes. It's dangerous. These are basically not true. And we understand that, with something new, that there comes a lot of myths and a lot of untruths about it. Like Dr. Pratt said, this is a safe and effective vaccine. Vaccines have been around for many, many years, and are one of the primary reasons that we don't have a lot of diseases in this country. So next slide, Dr. Pratt. So, Dr. Davis and Dr. Pratt were talking about how hard it is for people to get vaccines. And with that comes a lot of people out there trying to make a buck on the fact that, you know, we do have a bit of a shortage and it's hard to make an appointment. So just know that there is no special deal if anybody calls to say, hey, they can help you get an appointment at a low cost, or they can pay you under the table and get you on a waiting list, and especially have some kind of miracle cure. It's all a scam. One, there's no miracle cure. We do not pay or allow people to pay to get on the waiting list for a vaccine. And the vaccine has already been paid for by the federal government, so it should be no cost to you. So anybody calling to say that if you pay them, they can help you get the vaccine is definitely a scam. And so we want you to report any of these COVID-19 scams to the Department of Consumer and Business Affairs. And Dr. Pratt has so kindly put the website as well as the phone number on the slide to make sure that you can get your money back. So, and with all kind of scams, you don't want to give anybody your personal information, your address, your social security number. You want to protect that at all costs. Next slide, please, Dr. Pratt. As Dr. Pratt said, our website is basically the one-stop shop for information. So if you have any questions about where you are in the tiers, or where to find a vaccine, or who we're vaccinating, please go to our website, vaccinatedlacounty.com. You can also sign up for emails to get our newsletter that talks about COVID vaccines and where to get it, how to get it, how to make an appointment, what numbers to call. That is all there for you. And it changes about every week. So please make sure to go on as much as possible to get the most current information. Next slide, Dr. Pratt. Thank you. We also want you, if you get vaccinated and when you get vaccinated, I hope you will after this presentation, please, we want to make sure that you continue to use the safe practices that we have put in place to protect us all from disease. So continue to wear a face covering, continue to avoid close contacts with others, and not go into crowded spaces. Always keep your hands clean and disinfect frequently touch surfaces. And then if you do come in contact with somebody who is positive for COVID, please make sure that you quarantine. And if you do unfortunately get COVID, make sure that you isolate yourself so that you do not spread it to others. Next slide. As Dr. Davis alluded to in the beginning, we do understand the effects of racism and the history that has happened before, but we are all working diligently to make sure that this vaccine is distributed in an equitable fashion. And that includes to those that are hard hit in the minority community, all Black and Brown communities. We want to make sure that we are getting the vaccine into the arms of the people that have been most affected. So, and this is no experiment on people of color. As Dr. Pratt mentioned, we understand the history, but this vaccine is definitely not an experiment. It is definitely a way to get us out of this pandemic and to provide protection for everyone against this COVID vaccine. And we have included people in the community on work groups, on panels, to make sure that we hear from you so that we can understand how to better message to our communities and to your communities so that you can go out and share the message with others as well. Next slide, Dr. Pratt. So for those that are still having problems getting through, we understand not everybody is computer literate and not able to use a computer, but there is a toll-free number that you can call 7 days a week to request assistance with making an appointment. We do encourage that if you are able to use a computer and you can, please try to book your appointments through the computer. This phone number is really for those that don't have any other way to make an appointment. So, and please feel free to share it. We want people to be able to get an appointment and as soon as possible, and more appointments and more sites are opening up every day. Again, if you need to make an appointment, you can go to the vaccinatelacounty.com. And that is the one-stop shop to receive information about the vaccine, and as well as the tiers of people that we are vaccinating. And with that, I think we are done, and we'll turn it back over to Dr. Davis or Ms. McDonald to answer some questions. Thank you.
I know there was some questions in the chat, so Valerie, I don't know if you want to go through those. If you want to just
Well, we have
those.
Dr. Walton and Quarles Jackson, who have been monitoring the chat rooms and will alert us to the questions that have been, maybe there's a common thread to them, or someone has a particular question, but I will turn it over to them to see if they have some questions. I know there are quite a few of them because I've seen them pop up.
Good evening, everyone. But first of all, I'd like to thank Dr. Davis and Dr. Pratt and Ms. Burr for this very valuable, taking this time to share this very valuable information with us. We truly appreciate that. And as Dr. Davis mentioned, he has been working ahead of us, answering some of the questions in the chat, but I think it would be great to let everyone hear the questions and hear the answers. So we'll go ahead and start with some of those questions that were put in the chat. If that's okay with you, Dr. Davis, and I'll let you answer those questions, okay? The first question was, if the COVID vaccine prevents one from getting the virus, why would we still need to wear masks?
It's a great question and a good point to clarify. So in terms of the studies, what they did find with that was that the two vaccines were greater than 90% effective at preventing illness. So that means you are, it's 95% effective or 94% effective at keeping you from out of the hospital or dying. What we don't know and what still needs to be seen, though you don't have symptoms, is being further being evaluated as people get vaccinated, and even for those who were vaccinated in the trials, to see whether or not they come down with the illness or end up able to be infected and pass.
I may ask you to repeat that, Dr. Davis. Dr. Davis, we're
protective measures until we're certain from
Dr.
the data
Davis,
that
excuse me, would you mind repeating that? I
can't
think
get illness.
we can't understand you on the chat, on the answer.
His connection is raggedy.
I sent a personal chat to him.
Do you want me to repeat it?
Yes,
Yes.
please, thank you.
Oh no.
So
Would one of your colleagues
Dr.
like to
Pratt,
answer that? Dr.
can you
Pratt would
take
like to answer that?
that answer? Let's see if your connection is better.
No, I'd be happy to. What Dr. Davis was detailing for us is the vaccines were in the 94 to 95% range of being effective. So we have 5 to 6% of the population on average that will not develop protective immunity. So kind of, like 1 in 20. And we can't predict in advance who that person's going to be. So until we get a better handle on how immunity develops and how long it lasts and how we can boost it if you don't respond initially, we encourage everyone to continue the masking, the social distancing, the hand washing, the avoidance of crowds, all the same precautions until we just learn more and can share more information about the best way to be safe in the era of vaccines.
Okay, thank you. The next question was this vaccine used in other countries? And I think you did mention that they have been tried in the other countries. Is that true?
Yes.
Yeah,
both-
can you hear me better now?
Yes.
Yes.
Go ahead, Dr. Pratt.
Yeah, both of these vaccines, in fact, most of the candidate vaccines are tested in 2 to 3 to 4 countries around the world.
Okay. And
They've
then
also been approved, if I can add, they've also been approved and in use in other countries as well.
Yeah.
okay. The next question is, what does the 6 feet distance really have to do with getting COVID-19? Either Dr. Davis or Dr. Pratt, would you like to take that question? I think what they're trying to ask is, why do we use that 6-foot rule supposedly? How does that help prevent us from getting COVID-19?
Dr. Davis had a reply. He said that respiratory droplets produced when an infected person talks or coughs can travel 6 feet from the person's mouth, sometimes further, if there are singing, shouting, or laughing. So staying at least 6 feet, maybe more, helps to protect you from those droplets.
Okay. All right, Lauren, are you ready? Dr. Walter, are you ready to
So
go?
we had a really robust response in questions. So I'm going to go through some that were submitted previously. Number 1, what provisions are in place for disabled persons to get the vaccine? For example, those who do not drive or cannot use public transportation.
Dr.
So I
Davis,
can- Yeah, I'll try. And if you can't hear me, I'll become choppy again. Just somebody raise a hand and I'll stop. So one of the things to know is that there are clinics that also who may be seeing these same people who may be receiving the vaccine or are able to offer and administer it at their sites as well. We have also been using and trying to build it up, but some mobile vaccination clinics that are going to at the moment, because it's seniors 65 and older who are eligible to go to senior housing, that allows them to not have to drive or go somewhere to register online, et cetera. But we expect more and more that this will be provided by providers, and so those who are taking care of them would hopefully be able to administer it. But we keep trying to figure out different ways to get to populations if they can't, go drive to a site as well.
Excellent. Thank you. The next question, probably for Dr. Pratt. How long does the vaccine last, or what is the length of protection?
so that's an important question, and many of us are thinking about the answer to that question, and right now we're not sure. We are comfortable saying that if someone has COVID infection, they're protected for 90 days. We do know that people can get a second infection. So it's hard to say for any given person how long it might last. Some of the manufacturers are giving us longer times, but right now the answer is not clear. we need that time, if you will, just to follow people and see what happens and how they do. We might be looking at a situation where COVID becomes kind of just endemic, if you will, in the communities. It's just part of our world. And we know that every year we get a COVID immunization, just like every year we recommend an influenza immunization. But right now we just don't have enough time under our belt and experience to make a decision about that or answer that question in a precise, accurate way.
No, thank you for your candor. I'm really struck by the transparency and the clarity of your presentations, and you just sharing exactly where we are. So thank you. One more question, and then we'll switch to Dr. Quarles-Jackson. What should you do if you can't get the second vaccine in the recommended time frame?
I'll take that one too. That's
Sure.
So the time frames that are emphasized are the minimum number of days between the two doses. We want that first dose to prime your body, to like prepare it for the second dose. Ideally, you get your second dose as close to the 21 or 28 days as you can. But we have a lot of experience that if you delay a few days or a week because things just happen, you have to live your life or you can't get an appointment, you still just get that second dose as soon as you can. And history would tell us that most second doses, even if they're extended a little bit, still give you a good boost response. So ideally, as dictated, as prescribed, but otherwise, as soon as you can after that. And we don't anticipate a serious problem with that right now.
Yeah, and we've been advised also that if you're beyond that period, even if it's a couple weeks, that you don't have to restart, so you don't have to do 2 doses again. And the World Health Organization has also said that if for some reason it can't be gotten, being even up to 6 weeks is okay. But we don't want people to wait that long. What was studied was 21 days for Pfizer, and what was studied was 28 days for Moderna. So being as close to those dates as possible is what was studied, and that's the evidence that was produced when it got its authorization.
Oh. Let's see if I can unmute.
Unmute yourself.
Unmute you, Steph.
The next question is, what exactly is herd immunity? And Dr. Pratt or Dr. Davis, either one.
Dr. Pratt, do you want to do this since this is your world with vaccines?
Sure, happy to. So community immunity or herd immunity means that enough people in your community are protected that the virus can't keep spreading. The virus, in this case, tries to go to another person and infect that person to kind of keep the chain of survival going. And it runs into somebody who's got immunity and it's a dead end. So when all the virus particles and all of the folks in the community that have the infection, when those viruses try to go to extend their life and make more viruses, they hit a dead end. So you create enough immune people and you create enough dead ends that the virus has nowhere to go. And like these living organisms have their own lifespan and they die. So and the history on this is some of the initial work on vaccines was done on herds of sheep. And they did the analysis, and that's the origin of the phrase herd immunity, because it was very valuable for preserving the economics of farming in the very beginning of the vaccine world.
Great.
Thank you for that explanation. The next question we have is, once vaccinated, will we need to receive another vaccination annually? And I'll give that one to Dr. Pratt.
Again, we just don't know yet. Hopefully we'll find out within a year or two where this is going. And some of the choices are, it's an annual vaccine, just like influenza, or many of us, we get our tetanus shot every 10 years. Maybe it becomes an every 10-year vaccine or a lifetime. Right now, we just don't have the information to answer that question. But hopefully we'll have it soon.
We're hoping that it doesn't become that.
Dr.
Yeah.
Walton, would you like to go next?
Sure. This is to follow up on that. What are the ramifications for those who do not want this vaccine?
There are no ramifications. It's not a requirement. It's this is emergency use authorized. So it's not like anyone, as far as I know, has required it to return to work or to travel or anything of that nature. It may become that at some point, but at this point, not getting it just means that you are at higher risk of getting illness. And as Dr. Pratt talked about the effectiveness, what I was trying to say also earlier is that they were proved to be effective at preventing illness. So preventing people from going into the hospital, preventing people from dying. That's really the effectiveness, and the question about whether or not you can still be infected, not have symptoms, and transmit to others. That's the piece that's not known. So that's the other reason why you're still wearing your mask after getting vaccinated.
Okay. And another question from the chat. If a person has history of swelling from certain medications, can the vaccine cause a similar problem?
So go ahead, Dr. Pratt.
Based upon the 74,000 people that were initially evaluated, leading to the emergency use authorization, and some of the subsequent follow-up of people who've been immunized just in the last couple of months, that has not been identified as a side effect or a complication of these vaccines. So my immediate answer is, we don't think so. What I would recommend is, as a practicing physician, I would say, let's discuss in more depth what you're describing and make the best decision for you at this time. But if we look at the information we have now, we wouldn't be leaning in that direction of linking those two together, the immunization with swelling from medication.
Okay. And I'll ask one more, and then there's a general theme about children in schools that Dr. Quarles-Jackson, as the pediatrician, will ask. So another question that was sent, there have been reports of people dying after receiving the vaccine. What are the latest reports related to these deaths?
So one of my tasks today and tomorrow and the next day is to oversee the review of the vaccine adverse event reports. So, and of course, when there's a death associated with a vaccine, even just in time, that's a cause for immediate evaluation and determination of what happened, how it happened, why it happened. Right now, because there are people who will pass as part of any large population of people or have other medical issues that occur simultaneously with receiving the vaccine. There's no connection biologically or medically with the vaccine and that death or that complication. Right now, we're not seeing that related to any of the deaths, and one of which you might even have read about in the paper a couple of days ago. If indeed that is identified, the next step is the immediate stoppage of administering that vaccine. Because we have, in the past, we've had circumstances where significant complications were identified, and that's an immediate firewall, stop immunizing folks till we sort it out. But right now, we haven't seen that yet, fortunately.
If I can
Okay.
add,
Oh, go ahead.
if I can add really quickly. So, I've worked at a number of the vaccination sites, that we've had. Typically, and I've worked in observation sort of as after people have gotten their vaccinations. Typically what we see, some people are really anxious afterwards. You just talk to them, they relax, take a sip of water, and they're fine. Even for the folks that have had severe allergic reactions to medications that are observed not for the typical 15 minutes or 30 minutes, most people are fine in that. There have been very few evaluations related to anybody having an adverse reaction to things. And mostly what we see are people just being a little anxious after getting the vaccine, and typically that has gone away.
I just want to add one thing to that. Also, we recommend that any persons who have a history of allergy, if they have an EpiPen, if they've already been prescribed an EpiPen, we usually recommend that they bring that with them to the site when they're getting their vaccine.
Glad you raised that. And I will also acknowledge that there are emergency personnel with epinephrine, with Benadryl. There's an ambulance that's ACLS certified, and ACLS certified physician that's also assigned for each site in order to handle any emergencies as well. Thank you.
Thank you. The next two questions deal with schools. The first question is in the chat. It says, listening to the presentation, the ages for the vaccines do not include school-age children. So how are they to be protected as schools open? And then the second question along with that would be, do you support the viewpoint that all teachers should receive the vaccine before opening schools? And I'll give that to Dr. Davis.
Yeah, thank you. So there are a lot of things that have been put in place, both for work sites as well as for schools, modifications to improve the safety, within that environment. Whether that's from, having a stable cohort of students or smaller cohorts of students, less adults who are overseeing them, meaning 2 stable adults for a group, wearing face coverings, distancing between students, et cetera. All of those safety measures put in place help to reduce the risk of spread of COVID-19. And those are the things that, we've been doing for a while. And we've seen, even with the schools that have been had students on campus, their high needs students, that there hasn't been spread in the way that we've seen in the community as a result of those. So those are safety measures that are already put in place. Vaccines are just an additional safety measure in order to help, with prevention of spread. In terms of teachers having to have vaccine before they go back into the classroom, I don't necessarily think that that is a requirement. I mean, we've had many people who have been, working even without the vaccine with these safety measures in place. Our office is one of those. We have done well with that. So I don't think it necessarily has to be a requirement. I don't think it necessarily has to be that they have to be vaccinated before they go back. There are many others as well who are also in contact with the public who would also be eligible for vaccine at that time. But there are other measures that are also put in place in order to reduce the spread.
Thank you. Another question from the chat is, if you have received the first vaccination, will you be notified about scheduling your second vaccination?
Mm-hmm.
So
Dr. Davis,
I'll answer that one. Yeah. So what we've tried to do with all of the providers who receive vaccines is to really, have them schedule a second appointment. If they haven't scheduled one, to, start to notify people when their time is due to schedule their appointment. What we are doing in terms of distributing the vaccine throughout the county is, if a provider has given a vaccine, let's say it's Pfizer, and they've given 1,000 doses, then 1,000 doses will show up for the second doses 21 days later. So they will be given that amount that they need in order to cover those second doses when those second doses are due. But we have worked, at least on the county sites, to ensure that the second appointment is scheduled at the same time as the first. But we're working with providers to make sure that they do the same. It takes a lot of the stress out of worrying about whether or not that second dose is going to be done and when.
Okay.
And also,
thank
can
you.
I just add the new system that we're using? When you register for your first dose, it'll also give you an appointment for your second. So it makes it easier.
Yeah. You know, this is a good segue. There's a question, is there any real difference between the Pfizer and the Moderna? And if one is given the Pfizer vaccine first, can they have the Moderna second or vice versa? Oops.
You're on mute.
So, Dr.
Harry.
Pratt, you can answer?
Yeah.
Sure. So functionally, they're essentially the same right now. But as Dr. Davis mentioned before, their approvals really were based upon the fact that you were receiving the same one each time. So there has been discussion about, if you will, changing the brand, so to speak. But right now, that's not the recommendation, and we want people to take the same product for each one of the 2 doses.
Okay.
I have another question. One of the questions is, should I be concerned if I did not have any side effects after the vaccinations? Does that mean that my immune system is still responding to the vaccine? And that could go to Dr. Pratt.
I'm happy to take that one. The answer is yes. There's no relationship between the presence or the strength of side effects and the immune response. You can have a great immune response and have no side effects. So the answer is that's not an indication that you didn't develop immunity. The overwhelming likelihood is you do have protection and immunity.
Thank you for that answer. Dr. Walton, do you have any more questions?
You know, someone had asked about, do you want to eat before you take the vaccine? Is there any, I'll ask our public health nurse, is there some suggestion about eating or preparing for the vaccine?
No, I saw that question. Yeah, there's no recommendation as to whether you should eat before or after. I would say if you're hungry, eat. Sometimes the lines can be a little long, but there's no recommendation saying you should eat or should not eat prior to getting the vaccine.
Okay. And there was another question, and I believe this had been answered, but if someone has a family member that was delayed by weather, if you get the vaccine beyond the recommended 3 or 4 weeks, it's actually fine. I believe Dr. Davis said that. As long as you get that second vaccine, you really want that immunity.
That's correct. Yeah. So the minimal intervals are the 21 and 28 days are basically minimal intervals, and that's how the vaccine was studied. If you get the vaccine, a few days after that, you are perfectly fine. It's that you've actually got the 2 doses and you're able to get that effectiveness. And a lot of questions that I get in our public health email is, can they go the day before? Because I know people are working. The short answer is yes. The CDC says you can go a couple of days before. So if you get the vaccine a few days before that minimum interval, you will be fine. That's a common question I get just about every day, because I know people are busy and they can't make their appointments. But yes, you can go a couple of days before. The CDC says you can go up to 4 days before your dose is due.
Okay. So are we coming to a close on our questions, or how are we doing?
We have, I think, 2 more that are similar. Do we pre-medicate Tylenol, Motrin, or not?
No.
No, yeah, you don't
You
need
go ahead.
to. I do want to say though, and there was a question about aspirin. I don't recommend taking aspirin the time. Aspirin is also can a little bit with that. And if you're on a blood thinner, continue taking your medicine. But that's one of the questions that is asked, and you would be observed for a longer period of time just to make sure there are no issues with you clotting or that you're not bleeding more after the shot. But no need to medicate beforehand in terms of Tylenol or Motrin.
Okay.
Okay, Dr. Quarles Jackson,
I think I see one more question in the chat, and that is, how long can the vaccine be out of refrigeration, be out of refrigeration before it is administered? And I'll give that to Melanie, Ms. Barr.
Hi, so they're both a little bit different. So they both have to be defrosted and placed in the refrigerator. And so I believe for the Pfizer, it has to be at least 6 hours administered. And so there's usually not a problem. This vaccine goes really, really fast. And I'm sorry, I'm blanking out on the Moderna. Dr. Pratt, can you help me out with Moderna, how fast it needs to be administered?
Yeah, the Moderna is, once it's fully thawed, fully reconstituted and at room temperature, it's also a 6-hour discard. Now, and they had so basically once it's made up and prepared to give to somebody, it's also 6 hours for the Moderna. And none of these can be refrozen either, by the way. Yeah.
and I believe one more. Usage of surgical masks, should we be using them, and how often should one dispose of your mask? So some information on masking.
So surgical masks or procedural masks are really typically your sort of one-day use. But if it gets soiled or dirty, then you need to replace it. It just won't be as effective. I will say that we've also updated a lot of the guidance related to masking. The CDC has talked about how to get a better fit, what to look for when you're masking, so that it covers the nose and mouth, that it's a good fit around all of your face, covering your nose and mouth as well as the sides, that there aren't any gaps, and that it's easy for you to breathe through. And some other recommendations for those of you who want to double mask. And that would be wearing a surgical or procedure mask underneath a cloth face covering. And the cloth face covering helps to create a better seal around the edges for many who use a procedural mask. But there's more information on our website. We've just updated, actually it went up today, just around masking, what to look out for, and some recommendations.
Okay, excellent. Thank you so much. There was one last question. What do we do with those vaccination cards?
Keep them as souvenirs. No,
Keep them. So that yeah. Go ahead, Melanie.
Yeah, no. So they are proof that you were vaccinated, but once you're vaccinated, your information is actually sent to our California Immunization Registry. If everybody, if you didn't know, the state of California and most states have an immunization registry. It's a computer-based registry where your information will be held forever. So if you ever lose your white card or your immunization card, you can contact the registry and they will have a copy of your immunization record. So if we ever come to the point where you have to prove that you were vaccinated, that is a source. But yeah, for the time being, keep it. But yeah, I know it's going to be a little tough holding on to that little white card, but yeah.
Okay. Well, Ms. Barr, Dr. Pratt, Dr. Davis, thank you guys so much for joining us this evening. I know it's been a long day for you, LA County being in the situation that we are
I
in.
want to add to that, because the
Uh-oh. Dr. Davis.
You have to unmute. Dr. Davis?
Oh, I'm sorry.
There you
It
go.
was the delay on my end as well. I'm sorry. I just want to highlight on the vaccination card. The vaccination card should be given to you after your first dose, and then the date of your second dose put on that card. If you just got your first dose, you must hold on to that vaccination card, make sure it has your name and your date of birth on there, because if there are any issues in terms of getting your second dose, that's one of that's your proof of your first dose. So keep that card, especially during that time. Sorry. Thank you.
That's okay. Thank you guys so very much. As I said, Ms. Burr, Dr. Pratt, Dr. Davis, we thank you so much for joining us. As you can see, there's a wealth of questions that people still have about the COVID-19 vaccinations and how we get them, how we get the vaccinations to persons who are obviously not eligible yet. But we thank you so much for the information that you have shared with us this evening. I'm going to turn it back over to Bill, but I just want to again thank Regina, Helen, Bill himself for actually prodding us and pushing us in this direction, Dr. Quarles Jackson and Walton and Pastor Epps and the Second Baptist family. We could not have done this without you, and we appreciate always your support. Bill, I'm going to turn it back over to you.
Okay. Thank you, Valerie. Pastor, we're ready for our closing prayer. And again, folks, thanks for tuning in. And we certainly feel good about what we've heard.